Diabetes is a disease that affects how your body uses glucose, a type of sugar. The pancreas produces insulin, which helps glucose enter your body's cells. When you have diabetes, your body cannot use insulin properly. This can lead to serious complications if left untreated. The exact cause of type 1 and type 2 diabetes is not known, but experts think it may be due to a combination of genes and lifestyle factors like diet and physical activity. Diabetes is diagnosed when a person has high blood sugar, glucose, levels. Diabetes is a disease that affects the way your body uses food for energy. It can cause serious health problems if not treated correctly. Diabetes is a chronic condition, which means it lasts for a long time and you may have to take medicine for the rest of your life to manage it. The doctor may do certain tests to determine diabetes, including a fasting plasma glucose test, a random plasma glucose test, a glycated hemoglobin or HbA1c test, and occasionally an oral glucose tolerance test. The doctor may do certain tests to determine diabetes, including a fasting plasma glucose test and a random plasma glucose test. A glycated hemoglobin or HbA1c test is also done sometimes. Finally, an oral glucose tolerance test can be performed if the other three tests are inconclusive or if you have symptoms of diabetes but your blood sugar levels are normal on those first three tests. Most cases of diabetes are type 2 diabetes. Diabetes is an autoimmune disease that affects the pancreas. The pancreas produces insulin, which helps your body use sugar, glucose. The two main types of diabetes are 1. Type 1 diabetes. This is an autoimmune condition that can occur at any age in which your immune system destroys your insulin-producing cells in the pancreas, making it difficult for you to control blood sugar levels. 1. It's usually diagnosed during childhood or adolescence and requires lifelong treatment with insulin injections or pumps, healthy eating habits and regular exercise. 2. Type 2 diabetes, also known as non-insulin dependent, or adult onset diabetes because it typically develops later in life than type 1 diabetes, usually after age 45. With type 2 you still produce some insulin but not enough to keep up with how much glucose gets into your bloodstream after meals. So over time, high blood sugars develop as well as other complications like heart disease, stroke and kidney failure if left untreated. Diabetes is usually discovered by chance during a routine physical examination or some other medical procedure. To determine whether you have diabetes, the doctor may do certain tests to determine diabetes. These include 1. Fasting plasma glucose test, FPG. 2. This is a simple blood test that measures how much glucose is in your bloodstream after fasting for at least 8 hours. 3. The normal range is 65 to 99 mg per deciliter, milligram per deciliter. 4. With this test alone, however, it's possible to have normal results but still have prediabetes or type 2 diabetes. That's why it's important for everyone over age 45 who has risk factors for developing type 2 diabetes, such as being overweight, to get tested every 3 years starting at age 45 with an A1C test or FPG if they are not overweight. If their results are abnormal, then they should get retested again within 6 months. Random plasma glucose test, RNG. This measures blood sugar levels at random times throughout the day rather than just after fasting. Glycated hemoglobin or HbA1c test, also called hemoglobin A1c level. This measures how well controlled your blood sugar has been over time by measuring its percentage of bound glycated hemoglobin molecules. You should take care of yourself because you never know what could happen if you don't. The best way to take care of yourself is by eating healthy and exercising regularly, getting regular checkups and keeping track of your blood sugar levels. You should also keep all appointments with your doctor so that they can monitor your progress at each visit. Diabetes is a serious condition that can lead to many complications if it's not treated. You should always make sure that you are taking care of yourself and getting regular checkups so that any problems with your blood sugar levels can be detected early on. If you want to learn more about managing diabetes and reducing the risk of complications, be sure to check out the link in the comment section for more information and solutions.